Hey there, welcome back to the Intergenerational Trauma Therapist Show. Today we're going to look at cutting edge approaches for assessing intergenerational trauma impacts using the Intergenerational Resilience Method. So, this is the first week in April, where this month we're concentrating on advanced assessment techniques for working with intergenerational trauma. So, if you have felt challenged by the complexity of assessing intergenerational trauma and feel like you're missing pieces of the puzzle, this video is going to be really helpful for you. So, there is kind of this intricate web or interconnections between the impacts of intergenerational trauma. It can end up being pretty overwhelming and leave the therapist kind of questioning their effectiveness because they'll address one area and then another area of difficulty will pop up, or they'll think they have an assessment and have it clear, and then it'll shift and change. So it's kind of an ever moving target sometimes, and that's because of those large impacts on the family system. So advanced assessment techniques are specifically designed to unravel all that and get a really clear picture of the complexity of the intergenerational trauma and have the clarity and confidence to go forward and provide efficient and effective therapy for these families. So today we'll cover how to use the intergenerational resilience method for advanced assessment. We'll look at the role of resilience in families. We'll look at the continuum or kind of spectrum of intergenerational trauma impacts. And we'll look at how we can support families with knowledge about resilience and strategies to identify these in their family system and in previous generations. So we'll get started with just an introduction to advanced assessment using the intergenerational resilience method. Quick review of the intergenerational resilience method. This is where we have a framework that supports us to uh, increase autonomic regulation, increase earned secure attachment, support child development, and create connection and family resilience. So the system from the Courageous Way Intergenerational Trauma Program is designed to meet those four pillars of the intergenerational resilience method. But first, we have to know the impacts and how those impact the family system and how they impact therapy. So those five domains are first negative impacts on the therapy process. Now, these aren't really assessing within the family system, but these are certainly things that if you're not aware of and aren't kind of keeping an eye out for as you're progressing through your assessment and your therapy, it can really throw a wrench into the entire process of therapy, because of the impacts that people have experienced in some of the sensitivity that they have, especially if they feel as if they're being shamed or judged or feel like we're not understanding them. It's really easy for them to get frustrated because they've been dealing with these impacts for so long. So we really want to make sure we have an awareness of how trauma can impact the process of therapy in a negative way, and what are some of the hallmark characteristics that we'll see when this is happening. Number two is problems with co-regulation. Typically in families that are impacted with intergenerational trauma, the co-regulation is really more co-dysregulation because there's either high degree of the reactivity or there's a high degree of shutdown, and it can go between both of those opposites, which create a lot of problems with co-regulation, and then you'll find problems with attachment. The parents sometimes have a tendency to engage in what we call negative mentalization of the child. So this is understanding how the child is thinking and where their mind is at. So you'll hear things like, this child's trying to drive me nuts. He's doing this on purpose, because they have a negative interpretation of the child's behavior and understanding of the world and their kind of their motivation. So then we'll see parenting strategies that backfire. We'll see anything in a range from high punitive, kind of very difficult corporal punishment type parenting interventions, which, by the way, are not recommended, or we'll see a totally kind of lax and just a disengaged parent where there's no discipline and no structure in the family system related to expectations. And the relationship between the parent and child really suffers when you have those parenting strategies that backfire. The last area that we want to look at assessing is the child's negative self-beliefs. So between the ages of 5 to 7, the brain is in a state where it can put patterns together, so it can identify themes or patterns, but it can't go back and fact check to make sure they're accurate. So experiences around those years between 5 and 7 can really create negative self-beliefs that later go kind of unconscious and they drive behavior, but we're really not aware of them unless we get into some of like looking at some of the ways that people engage in self-talk or some of the beliefs about, I'll never be loved, the world is a terrible place. So we want to look at those child's negative self-beliefs as well, because those are going to impact the parent-child relationship as well. So to contrast this type of assessment with your typical traditional assessment when you're working with trauma is more individualized, where we're looking at assessing the family system. So it's more nuanced specifically for intergenerational trauma. So in traditional assessment, you may only assess the individual's amount of trauma and get kind of scores and find out where, if they meet criteria for a diagnosis or to get a baseline before intervention. But those are individual for whether you're working with the parent or the child. And you may also do some observations or assess the parent-child relationship in some ways to kind of determine where their attachment's at. So those are really good things to have, and you can do those in addition to these other steps. But these other steps get to the specific impacts of intergenerational trauma on the family system, which is really where intergenerational trauma is transmitted. It's within that family system and in those relationships. So if we don't address the impacts of intergenerational trauma on the family system in a really structured way, assessment becomes siloed. So it's like the child's trauma symptoms, the parent's trauma symptoms, and then kind of the attachment and interactions between parent and child, but they're very siloed. There's no integration really between those. So it's very inefficient to only rely on those individual assessments, and we'll miss some of the variables or some of the factors within the family that actually maintain the transmission of intergenerational trauma. That's our whole goal, is to stop the transmission and to heal the current generations that we have access to. So it's really important that assessment becomes really important. That's why we have a whole segment and month focused on advanced assessment techniques. So now we don't want to just focus on the negative impacts. We also want to focus on the resilience factors that we see in families, because if they've survived generations of trauma, they are resilient. They may not look resilient, but they are resilient. It's just the strategies they've used are no longer helpful and they're causing other problems. So it's important to map out factors that are related to family resilience and to integrate these into the family's narrative and understanding of their family system, and to emphasize the strengths and to build skills where they're kind of maybe not doing as well, or there's maybe some type of weakness in a certain area. So the areas that we assess using the intergenerational resilience method include finding meaning. How able are they to create meaning out of different situations, out of their interactions, out of good things, out of bad things? So finding how they interpret things and kind of their mental understanding of life in general. We also want to look at realistic optimism. Now, the word realistic is in there because a lot of these families are facing really difficult circumstances that we don't want to go in kind of with rose-colored glasses and just be like, everything's going to be positive and it's just going to be wonderful, because that can feel really toxic to some people who are significantly impacted. But that is a positive psychology coping tool to find kind of the silver lining, or to find that meaning and have some hope through that process. Also want them to have flexibility. Now, flexibility is kind of in the middle path where you can have kind of chaos or kind of rigidity, where chaos would be there's no rules, anybody can do anything, and rigidity would be more that there are very strict rules, and if you violate these, there's problems. So we want to know, how much flexibility does the family system have in meeting the demands of life, everyday life, in their relationships. We also want to look at their degree of connectedness within themselves, within other generations or extended family, within the community, within the school system. We want to know, how connected are they to various things that are supportive and healthy. And then we also want to look at, how do they use social resources? There's tons of resources everywhere that families can access. So are they accessing food banks? Are they accessing like a family resource center where they have parenting programs and kind of support groups for parents? Are they accessing mental health services? What kind of social resources are they connected with, and where might they need to be connected? We also want to look at their communication, because when we're either in a high state of reactivity or shut down, our communication typically shifts, and it can create communication difficulties in the family. So we really want to focus on, how clear are they communicating, and how open and flexible or flowing is the communication as well. We want to look at emotional expression and validation, like how much can a person in this family express and be validated, even if people don't agree with what the person's experience is, or they have a different experience, they can still validate that person's experience and accept it as their truth or their reality. So this is where, if that validation isn't there, it increases the impacts of trauma, because trauma is kind of a thing that happens when, and you feel so alone in the impact. So if you don't get validation, or you can't express yourself, it heightens those difficulties with feeling alone in what you're going through. And we all need that social engagement and connection to have a well-regulated autonomic nervous system. We also want to look at their problem-solving abilities. Like when something happens and there's a difficulty that impacts the family, how do they handle that, and can they solve the problem? So is it like a really rigid, like almost like a military, this is what we do? Or is it so chaotic that nobody has any problem-solving abilities, and it gets really even more chaotic then? We also want to look at their cultural connections. This is so important. This is one of the supporting factors in the intergenerational resilience model, is the culture, community, and history. So the culture is so important because it's a really source of awesome strengths if they can integrate it into their daily life or their family kind of narrative. But it can also be part of a lot of the intergenerational trauma that they may have felt. There may be some shame around that if they've been persecuted or had a lot of discrimination. So that's a really important one, that if they aren't really connected to their culture, we want to support them to at least learn and kind of integrate that into the story or narrative of their family. The last area is their spirituality. Like this could be tied to organized religion, or it could be just how they kind of understand and approach the world and kind of their beliefs and values. And that's another thing that is a great resilience factor. So now we're going to look at the continuum, or like a spectrum of intergenerational impacts. So this is based on both the impacts of intergenerational trauma and the resilience factors, to kind of get a map of where the family is in terms of how much impacts do they have and how many resources or resilience factors can they draw on. And there are two different approaches to assessment. So the impacts, we want to integrate those with the resilience factors so that we move more toward healing, balance, and wellness in the family. So we kind of look at this spectrum of having mild, moderate, and more severe impacts. So this isn't like we don't have confidence intervals, nothing like that. It's just a framework for you to understand the impacts of the intergenerational trauma and the resilience factors, and kind of get a gauge of how that's going to affect your therapy and how it kind of guides the treatment planning. So mild impacts would be like one main domain is hit most, and there's a few impacts across the other domains in those 5 domains of impacts. So that is your impacts on the therapy process, problems with co-regulation, negative mentalization of the child, poor parenting skills, and the child's negative self-beliefs. So you may see it mainly in the child with a lot of negative self-beliefs and a few things in the other areas, or you may find that the parent really struggles with co-regulation, but they have kind of good parenting strategies and they are really connected with their child, but they struggle with co-regulation because they're so dysregulated. So in this case, therapy goals and interventions can be highly specific and tailored to that domain that they need support with. So you'd go after the specific impacts rather than a more broad or general approach that hits all of those areas of impact. So in this case, when you have mild impacts, you can have a lot of flexibility in how you apply the interventions because the seriousness of the impacts is less, but we still want to treat it seriously and we still want to give them the best that they can have. It just doesn't need to be as structured in order to get to the end goal and to integrate those traumatic and resilience factors in the family. So the moderate impacts, what you'll find are significant impacts in at least 2 of the domains. So you may find difficulties in co-regulation and parenting strategies, or you might find difficulties in the negative mentalization of the child and parenting strategies. So it's looking at like what if there's 2 domains and there's a greater number of other domains that are also impacted, but they're not highly impacted. So in this case, therapy goals can be quite tailored and flexible, but they need a little more intensity and a little more structured than people who have mild impacts. The moderate impacts is what we just covered. So that's kind of in the middle range where you can have a little you can have flexibility, but you also need a little bit more structure. Now, in the more severe impacts, you're going to find impacts across 3 of those domains. So you'll find impacts in the problems with co-regulation, negative mentalization of the child, and parenting strategies. You probably also find in that case negative self-beliefs in the child as well, because that's kind of a natural outcome of those difficulties. So you'll see it'll show up in 3 domains and you'll have a high number of impacts. So in this case, therapy goals would need to be much more structured and maybe phased in order to decrease overwhelm. So the more impacts we have, the more we have to use Janina Fisher's example of slower is actually going faster. Because if we go right in and try to kind of tweak that family system and do it really intensely without creating safety and gradually building those skills, it can really kind of disrupt the family system even further, and they may kind of lose hope that therapy can help them. So when you have these more severe impacts, they're across domains, there's a high number of impacts, you really want to go slow and you want to build a foundation. And that's why the intergenerational trauma program is phased in order to meet the needs of all of the range of impacts, but specifically to, in its purest form, to support those more severe impacts. So in this, with the severe impacts, therapy is going to require greater structure. You're going to have to kind of stick with almost like psychoeducation and intervention that way, rather than a lot of therapy discussion to begin with. Then the next phase is looking at the impacts on the parent and their complex trauma. And then we work with the child. And sometimes you may want to start them at the same time. It's really important to do a thorough assessment to find out what way is going to be the most efficient and effective in order to get some relief for the family. Okay, so now we know about that spectrum. We're going to look at how we can support that family knowledge of intergenerational resilience and a couple strategies to do that. So we need to educate families on resilience factors and how to kind of hone these and develop these, and what would be in a range that is integrated and well maintained. So we teach them about the concepts of intergenerational resilience and how important it is. So one of the ways to do this is a family resilience map. This is an intervention that we do where we look at, kind of follow the interpersonal neurobiology by Daniel Siegel, where he looks at rigidity, chaos, and the river of integration between those. It's also kind of a dialectical as well, where you've got the two seemingly opposites and a middle ground in the between them. So we want to look at those in those areas of finding meaning, realistic optimism, flexibility, connectedness, social resources, communication, emotional expression, and validation, as well as problem solving, their cultural connections, and their spirituality. The second intervention that we can do is a resilience genogram. So if you're a family therapist, you probably use genograms in every case that you do. Genograms are really, really helpful in intergenerational trauma because you can see the patterns as they're laid out. So we want to assess at least minimum 3 generations in the family, so the child, parent, and grandparent. So we want to look first for problematic patterns, because we need to understand and know those. So we want to look at things like substance abuse, gambling, incarceration, cutoffs where parts of the family aren't in connection or they've completely torn away from another part of the family or one person. We also want to look at the history of traumatic experiences and their relationship difficulties. So what kind of attachment patterns are present in the family system? Are there any split loyalties where if you talk to this person, I'll never speak to you again, and you can't balance those two relationships that are in opposition because there's pressure to split and be only kind of close to one of those people? We also want to look at triangulation, like where does this happen? The most common spot I usually see it is between the grandparent and a grandchild and the parent, when the parent isn't able to do the parenting in the moment and the grandparent is doing the parenting. So it's really easy to have split loyalties and triangulation in those situations. So we need to work really hard to integrate that parent in the relationship in a way that eliminates those split loyalties or minimizes them, and it minimizes the triangulation as well. We want to look at significant life experiences, both positive and negative. We want to look at historical and cultural traumas. Now, these, for some generations, they may be further back than the grandparent generation. So you may want to also include like any of that stuff kind of above the grandparent row when you're doing a genogram, so that you can really understand the history of the family up like 500 years ago. There's things that have impacted families that may not be within these 3 generations, but they're back in the history that have had huge impacts on the here and now today. The other thing we want to look through when we do this is we really want to look for those resilience factors in family members and in previous generations. So we want to look at where the close relationships were, who supported who, how did they do that, who overcame adversity, like who was in a difficult situation and turned their life around, and how did they do that, and who is a person that exhibited great strengths and maybe had resistance and fought back and fought for their rights. We want to look at role models, like who in the family is somebody that most of the family members look up to, and who inspires in this family, who's a very inspiring figure. So we want to grasp a hold of those so that they can be integrated into that family narrative. So when we have families that have really significant cutoffs, there are circumstances where going no contact is likely recommended. They're more rare, but they can happen, or there can be a disconnection, whether it be through adoption or having been placed in child welfare. So there's all kinds of ways that families can be disconnected, and if we can't get much information on the biological family, it's of course important to include any kind of foster or adoptive family. That's kind of self-explanatory because that is the family system that the child grew up in. But we also want to include members of their family of choice. They may have friends that they have become so close with that their parents are like their parents and they know the whole family system. So we really want to include those because of the high degree of disconnection that can happen when there's significant intergenerational trauma. So from this, we want to build a resilience-informed narrative of the family. So it guides the family in kind of reshaping that narrative around strength, survival, connection, resilience. And we really want this to contribute to their healing and growth. So those are the two strategies that I would use for developing that intergenerational resilience and really looking at harnessing that within the family system. So there you have it. That's how Intergenerational Resilience Method supports advanced assessment. So we've covered assessment using the Intergenerational Resilience Method in the 5 domains. We've looked at the role of resilience factors in families. We looked at that continuum or spectrum of family, the intergenerational impacts in families, and we looked at 2 strategies to build resilience in the family. So I'm so honored you were able to join me here. And next week, we're going to be looking at the key trauma indicators in intergenerational trauma. So I hope you will be able to join me there, and I will see you then. Have a beautiful day.